Hi there, I'm Claire McDonald-Liu and this is the Family Health Lab. In today's conversation, I'm talking with prominent architect Josephine Barbarino. Josephine is talking about the food changes that she made that put her diabetes, Hashimoto's, chronic kidney disease and asthma into remission. Determined to help others, Josephine founded Keto Live, holding conferences and training medical professionals around the world in nutritional therapies. But she still has big plans. Find out how we can all benefit from Josephine's next ambitious projects.
You're listening to the Family Health Lab. Healthy parents, healthy kids.
Hi there, Josephine. Thank you for jumping on this call to talk about keto diet therapies and all of your absolutely fantastic work that you're doing.
Oh, thank you, Claire. I'm so happy to be here because I'm impressed what you are putting on, how much information you put out there, and really shout the news from the rooftops and get the most important people on your podcast in such a short time. I'm so impressed. So fantastic work you're doing, and I'm very proud to be on your show.
Thank you, Josephine. That's absolutely that's really kind, but coming from you, that is quite a compliment. So I'd like my listeners to know more about you because I think you're a phenomenon, and in a number of different ways. But I thought I'd start off by asking where in the world you are. Are you in Bavaria right now? I don't know very much about it. Could you let me know a little bit about what the weather's like, what your view's like there?
I love to. The view is grey and rainy, but I'm looking onto a big church. So Bavaria is very Catholic. We have churches all around, and it's in the middle of Europe, really. Actually, where the last pope, the one before, came from, very close to it. So I'm actually directly at the Austrian border. So from my living room, I can see Austria. It's only a river between us, so very nice. Half an hour from Salzburg.
I'm imagining clean, fresh air and quite a historical city, old building.
Historical city, you're right, but unfortunately, exactly our area is the biggest chemical factories in Bavaria. So I'm unfortunately not in a very healthy surrounding. But maybe this is the reason why I want to put all my project into Switzerland. Because there it's better. At least to spot that. Yes, I look.
I've seen the images. I mean, I've looked at images of Bavaria and the castle, etc. It looks beautiful. But yes, Switzerland, absolutely stunning, absolutely pristine. So you are working tenaciously on so many different, not so many different projects, but big projects with enormous scientific credentials. I have to touch on what brought you here to be passionate about nutritional therapy. And I know that you, this started for you with a suitcase that you used to bring to your work as an architect. Tell us about your suitcase.
Absolutely right. So I always call it my former life, the life before keto, because this gave me a new life, actually, not only in my health, but also for my career. Before I was a very successful architect. I'm the first woman who built it, not only designed, but also realized a theater the size of the Munich Opera, so really big for 1,400 people. And exactly opposite from the famous Neuschwanstein Castle. So everybody knows Cinderella Castle, that's the original. So this is what I did in my former life. So I'm an architect. Actually, I'm not a medical. I have no medical degree whatsoever. I'm not a dietitian or a nutritionist. I'm not a coach. I'm nothing of this kind. I'm just an architect. But I have my own health story, like maybe some of your listeners already know. I was diagnosed 2014 with type 2 diabetes. It was already insulin-dependent type 2 diabetes because I never took really care about what's a metabolic syndrome. My doctor told me, you have the metabolic syndrome, you should lose weight, you should, and so on, blah, 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 all these things. But he never told me this will lead to type 2 diabetes, which would have shocked me. Anyhow, 2014, I got this really shocking diagnosis. And I was very afraid of it because my grandfather and my father-in-law had it and they died from diabetes. So I didn't want to start. And I did what every doctor hates. I went to Dr. Google and found Andreas Einfeld, who saved my life.
Your particular story, that suitcase of medication, you were taking up to 20 medications a day, different tablets, by the time you were diagnosed with diabetes. So, you were kind of stacked out with a bit of a laundry list of health complaints that had built up. And that's kind of what happens, I think. We kind of have treated that like middle age, with that slowing down, that kind of feeling lethargic, that a pill, we need to take something and another pill to correct that and another pill. A lot of us have become that seen as normal. And you were asthma, diabetes, Hashimoto's, chronic kidney disease. It was pretty diabolical. It must have taken it out of you, but you were still on site, still working away. And then you made these health changes, as we've said, with Dr. Google, and your doctor supported you. So, hats off for finding it.
This is very, very important. I always like to emphasize, if you already are on medication, or if you already have a health issue of any kind, especially like the very severe ones that I had, you should never try it yourself because it's such a really powerful medical tool. And with medications on, so you should find a doctor who can help you, or a dietitian. At least a dietitian who knows how to take. I
appreciate you pointing that out. Actually, that's a really good point, particularly with the medications. The heart, the statins, but the diabetes medications, so you can improve your health and then have problems then with medication being at too high a dose that can cause problems to your health. So it's really a really good point. So 2014, you found this. You managed to find a health professional who didn't know about this low carb, high fat ketosis approach, but you managed to, with your persuasive power, and I'm getting the impression you're a very persuasive person, you got them on board and they monitored you and supported you. And then what happened? You started to feel better and came off a lot of the medication?
Yes, within 3 months, really 3 months, my blood glucose numbers were totally normal. So diabetes was put into remission. And after half a year, I was able to put this suitcase in the bin with the medication. Really. It was fantastic. Of course, not all at once. They had to be tapered off. But things like, for instance, acid reflux. I was on medication for acid reflux like crazy, and it didn't help, actually, because I was just eating the wrong food. And now I know much more about it. And of course, I know now why it didn't help.
A phenomenal transformation. And then you must have felt quite strongly about it.
Yeah, I just thought, as you can see, I'm already old, so it wouldn't have been useful to study medicine or to become a nutritionist, and especially learning the wrong stuff. Not the wrong stuff, maybe, but not the right stuff.
So you got started initially by telling people about it and kind of being a bit of an advocate, and then connecting with people around the world. And then you saw a need for science, evidence, training, and that's how Keto Life came about. And could you tell me about the start beginnings of setting that amazing non-profit organisation up that's based, as you were saying earlier, you work from Switzerland and I believe in the US as well.
Actually, what I was very astonished that in the whole world, medical students don't learn anything about nutrition, or at least, like Georgia E. told me, only 2 hours. She only had 2 hours in her whole medical studies. So this is really what shocked me. I always I always think that if somebody buys a new car, he always will immediately ask, what kind of fuel do I have to put into this car? But we don't ask what we put into our mouths, or we think it's the right thing. We follow the guidelines. We think it's the right thing. But as we found out now with science, it's probably not the right thing, what we've been told. And so I thought we must educate or inform at least medical professionals about nutrition, and especially about these powerful therapies, metabolic therapies like the ketogenic metabolic therapy, because I was already that sick that I had to go on a really strict ketogenic metabolic therapy. So my threshold is 20 grams of carbs a day. I can't eat more, otherwise I go back. So it's very important also that, of course, it's so different with all the health problems that the ketogenic therapy can help. So it's epilepsy. Some children will be able to stop the therapy at one point after 2 or 3 or 5 years. Some have to continue. With type 2 diabetes, you will always have to continue. So it's different in all these. It just shows how very complex it is. And I think it's really necessary to have medical professionals to know about all these differences.
Absolutely. And a lot of medical professionals want this information. In a former, working in the UK on wellbeing programs, I worked for Macmillan Cancer on wellbeing physical activity programs. And one of the reasons we did a huge research project into why doctors were not prescribing physical activity for those living with cancer. And one of the key reasons was they didn't feel comfortable. They didn't know how much was enough, how much was too much. And they didn't want to be liable. They didn't want to get it wrong. So instead, they kind of avoided the topic or said, do very little. And it's again with nutritional therapies, those that are interested and curious, or those that really want to practice it, they need the boundaries, they need the parameters, the skills to be able to do that. And that's where a lot of your work is coming in.
Our whole organization started in 2019 with the first conference. I was putting on this huge conference, 5-day conference, CME certified, little crazy as a first one. But I was very lucky because I had the wonderful Thomas Seyfried, amazing scientist who brought up the metabolic origin of cancer by digging out the Warburg studies again. And he was part of the conference. Georgia Eid was part of the conference. So a lot of great, great people who really trusted me, an architect, to do a medical conference. I'm still astonished.
I think you're convincing, very convincing when you've got a mission, when you've got a project that needs to be done. I think you can make things happen. And also there's a lot of great people with, big brains that want this to happen and saw the need and believed in you, which is excellent. You've got quite a star-studied rock star lineup on your board and at your conferences in terms of medical therapies. You've got some great people who believe in this and are pushing that pilot out into the world in different areas. So do you want to tell us about the pilot There's a few different things coming out of the pilot, isn't there?
Yeah, actually, the pilot will be running 3 or 4 years, so it's really big. And we started with this first conference because we set up a non-profit association for ketogenic metabolic therapies. At that time, we called it European because we thought this is big enough, Europe, but it became very quickly international. I'm very grateful, of course, of that. And this unusual big advisory board that you just mentioned, normally you have 2 or 3 important people on an advisory board. But I built this huge advisory board because I wanted to really connect the sciences. Because what I found out with working in this field and studying by myself with videos and things like this and getting connected, it's such an unusual topic, because if scientists really work in this field, they are already very special, because it's not easy going. You don't find easy funding for the studies, so you have to be very much convinced that this is important what you're doing. And normally studies are paid by pharmaceutical companies, and it's the idea is to get a patent, but on nutrition you can't get a patent. And so it's very difficult to find money. Like, for instance, the labs of Thomas Seyfried, Professor Seyfried, he totally depends on philanthropy. And also what we can see now with the Baszucki family, you already had a wonderful interview with Jan Baszucki. So this is all private philanthropy. And it's amazing what they are doing. It's really fantastic. So I wanted to connect all these scientists who sit in their different universities working there, or really dedicated physicians who have been already convinced that this is the right way, like Georgia Eid. She's phenomenal and working in this field since over 10 years now. So I thought we have to put them together. And this was really the nice thing, because normally universities work for themselves because they want to have this patent. They want to be the first who find this new treatment of a disease. So they don't connect in their studies. But now what I found now, it's wonderful because they're all connecting and they start studies together, and so it's amazing. It's really amazing. And so I built this advisory board out of the people who are most influential in this field, I think. Still some missing, but I still hope to get them on board.
Target them, yeah, so you'll convince them.
Anyhow, they all committed their knowledge and their time, and this is really fantastic, to our pilot, to the metabolic health pilot. And we started with the idea that we want to put the information and the education out for medical professionals, because we saw the need. As you know, in the moment, for instance, with these fantastic new findings on bipolar, for instance, patients really want to use this, but there are no physicians out there that can help them, or who know how to treat it, how to use the ketogenic metabolic therapy and then taper off with the psychiatric medication. So they have to learn it. We have to have specialists who can do this. So anyhow, we had the idea to build a master and bachelor degrees for medical students in this group of all these scientists, of all these universities. And then after our first conference, when we decided to do all this, then came COVID. So we've been quite brutally stopped. And then also we thought, we can't wait till all these medical students are ready. This takes too long. We have to act now, because it was very clear already in the beginning that the ones who've been really in danger by this new virus of severe illness or even death was only the ones who already had a metabolic problem, health problem, like diabetes.
You're much more likely to have poorer outcomes if you were overweight or if you had chronic disease or a chronic ill health. So they're the people, the groups, and they're a large group of our population who are most in need of improving their metabolic health. And by that we mean really getting that visceral fat off, that weight, and reversing those diagnoses and coming off medications like you did. So that's you still saw the vast need, and you had this community together
to proceed quicker. So this was our desire in the group. We said we have to find a way how to make this progress quicker, to educate physicians, and how to use the metabolic therapy, and so we thought we will start to build the biggest possible medical education, and it's a postgraduate. So to become a specialist in ketogenic metabolic therapies, so that as a specialist you are already a physician. Yeah, you are already allowed to work as a physician, but then you do an extra study. So like, for instance, becoming a specialist on nephrology or cardiology. So because we think at the moment what science shows in the last 20 years, I mean, as you know, it's not a new idea. The ketogenic metabolic therapy is over 100 years old. But the new findings, actually, or the connection to non-communicable diseases, NCDs, is now, I think, 21 years old. So since the last 20 years, it's enormous what scientific proof really came out that the non-communicable diseases are only connected to poor metabolic health, poor metabolic function, and insulin resistance,
which was not talked about even, en masse on this scale, even 10 years ago. We really have massively stepped up our knowledge of those two particular areas. I still don't think the mainstream public are talking really a lot about insulin resistance and metabolic health, those terms, but we do talk about weight, and non-communicable diseases are in everybody's, thoughts, really, because it's affecting every member, every family has, some of those. And when we say metabolic health, we often hear the terms lifestyle disease or lifestyle-related chronic disease. We have these health world ways of sanitizing. What we're trying to say is food. But I mean, there's been a lot of emphasis on exercise, movement, and we know, they've been saying for years, exercise more, eat less. But really, the evidence has become clearer and clearer, so compelling that this is food-related harm, food-related diseases, and so therefore that's awful and tragic, that we get ourselves into those situations without realizing. You didn't realize the harm that was happening to your body until that diagnosis really shook you, and so many people are in that situation. But the good thing is, I like to go for a silver lining if I can. Is that means we can do something about it. We can reverse that, and we can change the way we eat. And it's phenomenal. It's, I've worked with somebody who was diabetic for 12 years, on 3 medications, tried absolutely everything, and within 3 to 4 months he was off those 3 medications. So the power of switching and changing your foods is remarkable. I actually got call from a lady who'd listened to my podcast and got in touch, and she was telling me about her husband diagnosed with diabetes, and she's very concerned. And her brother-in-law is currently in the hospital. He's just had his leg amputated and he's had a heart attack, and his cognition is, his language and his cognition, his motor skills have really been affected. And Josephine, he's 58 years old. And it's those reminders of what this means in practice. We're trying to do what we can. I'm trying to put information out. You're absolutely changing the world. But yeah, that's what it...
Not sure.
But that's what it means to people, this man has not been given the opportunity, the information and the support. And that's because of what he's eaten, that other people are eating and drinking. And that's his current outcome. And that's what you're working to help people. I have to say, I've just got the absolute ultimate respect for people who change their own health and then work so hard and so tenaciously to help others. So a lot of respect for what you're doing. In terms of the training course that you're putting on, the postgraduate qualification, is it only for physicians, only for medical doctors, or can other health professionals access that? What about who can access that?
We want to build a center, a real physical center out of bricks and mortar in Switzerland. Or we don't want to build it. Actually, it's already there. The project is already there. The building is already there, that we have in mind, that we now try to secure. So we would like, or my imagination is that I would love to open the center by 2024, so next year. Very short time, but...
If anybody else said that, I would think, no, it's not going to happen. But because of your background in project management of epic scales with your architect project, I did have a look at some of them. They were phenomenal. I do believe you could pull this off. What pieces are missing from the puzzle?
So what we need now, of course, is partners. Really, really important now. We need business partners, or who would like to invest in this project, but also foundations, of course. My dream is always to follow this fantastic idea of the Baszuckis. They really... They are phenomenal, I think, with their movement. So, because what they started, they started their own foundation. They are in the great position that they have. They earned a lot of money with David Baszucki's inventions and his business. So, but they put a lot of money into this foundation, and they made something fantastic together with the Milken Institute. They found 3 other families who also have their family foundations on mental health, and they put them together as one big, it's called BD Square, what they're doing, and they're really moving things now because they now have the money to put research out in this particular field. So they are my big heroes, how they built this.
And that model is really, really important, that finance model, because industry, as you were mentioning earlier, they will pay for research if there's something that they can patent, particularly the pharmaceutical industry. And we know that 4 industries in the world are responsible for a third of global death annually. So tobacco, alcohol, unhealthy food and fossil fuels. I mean, that's crackers. I mean, beyond shocking, that statistic. But it just leads organisations like yourself in a position where there's the vast majority of businesses and organisations and institutions aren't suitable partners for you, which is why you probably need to go down this philanthropy route with reputable organizations and foundations.
That would be just the best solution, of course, because I will now explain you what we have in mind. So we want to build this center. The idea is already created, how we want to run it, and it should be on 4 big pillars. So we want to, the first pillar is prevention and wellness. So people could come to the center as a wellness vacation or something, find out what state is their metabolic health in. Because with many of these non-communicable diseases, they start progressing very slowly. But you could detect insulin resistance, which is the root cause of many of these diseases. You could detect this very, very early. So this is one of our very strong goals that we have. We want to put the detection of insulin resistance really on a high level. It should be as a mandatory check for, I think, people with 30 years or something like this. This should be paid by health insurance companies, because we could put heart disease, heart attacks into, which are now the number one cause of death. Sudden heart attack, and we could put this really into much smaller numbers if we could detect the insulin resistance early enough. But also cancer is already, for instance, I was shocked when I had to learn that a breast cancer of the size of a pin is growing for 10 years, something like this. So there are, of course, cancers that are much quicker, like glioblastoma or things like this, but many cancers really go very, very slowly, and it's related to insulin resistance again, and diabetes is related to insulin resistance, and Alzheimer's and Parkinson's and dementia related to insulin resistance. So, and this is one of the very important things people have to know. There is no medication against insulin resistance at present. There is medication to lower blood sugar. There is medication to do many of these things. But against insulin resistance, it's induced by bad food or the bad choice of our diet.
Modern foods, highly refined grains, which really means, often the healthy choice cereal that you're trying to do your right thing, getting your Special K or your Wheat Bix or whatever, and it's still those highly refined grains that turn to glucose and feed this biochemical process over a very long period of time that raises blood sugar, changes your hormonal endocrine response, and can cause inflammation and cause all of these. But I think a lot of the time I hear, I haven't got a sweet tooth, I'm okay, I don't eat sugar. But because you didn't have a sweet tooth.
No, not at all. I'm always saying I get my diabetes from carrot salad and latte macchiato.
Same way, again, since I heard that you were having carrot salad every day, and that's one of the things you thought prompted Hashimoto's, asthma, chronic kidney disease, almost a partial stroke, and diabetes. Carrots.
Of course, I had lots of pasta and sandwiches and things like this, of course.
Modern, highly refined processed foods that look like our traditional everyday normal foods. But that's one pillar of your plan, the prevention. Yeah.
So this is the prevention. So people can come to our center to find out their state and what's wrong, and they can learn how to eat right and how to go on a ketogenic diet. So if they're not sick, they don't have to go on a real therapy. They can go low carb, but they can learn about this. Then we have the medical part. So people can come to our center who already have a disease, who already are diagnosed with diabetes or with other metabolic problems. And they can have, we have our medical team there, very high fantastic medical team. At the moment, I can't reveal who it is, but it will be, so hopefully. Yeah, I will. So we have a fantastic medical team. We have endocrinologists, psychiatrists, psychologists. We have cardiology, specialists in cardiology. We have specialists in cancer treatment. So we have really the whole array of the non-communicable diseases.
My goodness. So it really is all-encompassing. So mental health professionals. So it won't just be the obvious or typical metabolic health conditions, the weights and the diabetes, fatty liver, and it will be the other areas of health and cancers diagnosis as well. Okay, and mental health as well.
Absolutely. And for cancer, it's also very important, as we now learned with a lot of studies, that, for instance, even if you do the traditional treatment, you could ease the side effects of a chemotherapy if you before you went on a ketogenic metabolic therapy and just made the surrounding of your health a little better, then the outcomes of the chemotherapy will be enhanced, and also radiotherapy the outcomes will be better, but the side effects will be less. So, and also after you had these, so for rehab, it's also very important. If you then go on a ketogenic metabolic therapy, you will be much quicker. You regain your health, which is often very bad after these very, very heavy chemotherapies, which are sometimes needed. So we are very, very proud because this year our conference was certified, the whole conference was certified by the Swiss Society for Medical Oncology. So not only our day on cancer, but the whole conference, which is on metabolic health, but also on heart disease, also on diabetes. And of course, we know that people with diabetes are much more likely to have cancer. So they understood, and I'm very, very proud. One of the reasons why we go to Switzerland is that they may be a little bit ahead in Europe. But anyhow, I want to go a little deeper into the center again. So to explain our medical part, what is one of my favorite or very dear to my heart is, for instance, if you can imagine that a family that is confronted with a terrible diagnosis, like their child having type 1 diabetes, they already been to many nights in the emergency because of the disease, and they are really they are frightened because what the doctors told them, that probably the child will have kidney problems very early on, and all the terrible side effects that this disease has. And but we now know that with a ketogenic metabolic therapy, we can't put it into remission. This is not possible. But we can manage it much better so that the need for insulin is lower. They always will need insulin. This is not the question. And I'm not against insulin, don't get me wrong. And I'm not against medication also. So there are pharmaceuticals which are fantastic and necessary, but I have to make this clear. But for instance, with type 1 diabetes, so a family who is really, they heard about it, but they are scared to change anything or go against the current advice that you can eat anything. They tell you if you're diagnosed with diabetes 1 or 2, there is no difference. They tell you, the doctors and physicians and practitioners who work with you will tell you that you can eat everything you like. You just have to adjust your insulin intake. But this adjustment is very, very difficult, and most people can't manage it, and then they get very afraid because they are afraid of hypos. They are afraid of the consequences. They don't do sports. In some countries, it's not allowed to become a pilot if you have type 1 diabetes. In other countries, you have to do certain testings to be able to drive a car. So you're very limited. And of course, these parents are desperate. Absolutely. But in our center, we give them the possibility to come with their child to us and learn how to use the ketogenic metabolic therapy, how to cook the right foods to really nourish their family and not the disease. This is always what I like to say. This is because there is so many people still say it's such a difficult diet. It's not difficult. It's wonderful. It's delicious. You can make wonderful food, and they say it's difficult to follow. And for instance, especially with epilepsy, it's terrible. You still are told if you have epilepsy as a grown-up, you're still told, no, this is only for children. You shouldn't do this. Much too complicated. It's not too complicated. It's not true. And patients really like to do something. They like to be active to fight their disease or to manage their disease in a better way.
And we can say that it's not for everybody. I mean, I ran groups with the NHS for patients who had diabetes or pre-diabetes, and out of those groups of 20, there was always a couple who found out about the changes in food and the foods to make the adjustment into a low carb, high fat that they would have to switch from. And it wasn't for them. They were like, no, I want my bread sandwiches, I want my potatoes, and I want my porridge. That's the way I've been living for, 60 odd years. That's what I'll do. So it's not for everyone for a variety of reasons. But for others, it's just, well, if I eat eggs instead of porridge, and if I eat chicken and protein for lunch and vegetables with that, or salad or whatever, and I eat and I swap out the pasta sheets and just have vegetables instead of that portion, I can manage my condition, perhaps get off medication. For them, it's a lifeline. So and being in that position as a family, years ago, talking about the option of a keto diet and hearing it's unpalatable, it's unsustainable, and all of that nonsense, I think we would have loved it if we'd have had an opportunity. And as you were saying that about parents who were sad and concerned and frightened of the diagnosis that they had got, we were in that situation. And I remember me and my husband looking at the options and trying to find a center. It was actually, we were looking at ketosis and we were looking at CBD oil as well. And we were tracking down places in Europe we could relocate to that CBD would be legal and we would be able to get hold of it. And so, there are people who will travel and stop everything and change everything to have a chance.
For the first time, we really also like to put all this together in this really needed holistic medical idea of treating NCDs and not only parts of the. There's just again a discussion on Twitter, I think, and I always love the punchline of Georgia Eid, who said most science agree that the head is part of the body. Because everybody's so astonished that you can treat neurological diseases by food.
Yes, the separation has been incredible, how we've split up aspects of the body. I remember when my son had alopecia and eczema and another skin problem. And I was saying, right, so what's the root cause of these together? And they were like, we're not looking at them together. We never will look at them together. We'll look at different topical treatments for them individually. I was like, okay, that makes no sense. And that's, psychiatry now, we're showing, like with Chris Palmer, Dr. Chris Palmer and Dr. Georgia Eade, both involved in your work, that what food can do for food and mood, but really, you know, how food influences depression, bipolar, schizophrenia, and then eating disorders. It's exciting, actually.
We will put the fourth pillar is research, because like this, we having these patients remotely, but also at the center, we will be able, and we are working together with Dorian Greenoff and Gemma Koches with Keto Mojo. They are our partners, and we can work remotely with the patients, but also get their physicians involved, and we can have the data. If the patient agrees, of course, we can have long-term data. So the patients start with us with the ketogenic treatment, and then we can put with the measurement of the blood sugar and the ketones and their diet, if we have it all in an app, all put into this fantastic cloud that they created at Keto Mojo that is not connected to any special app, but you can put all the apps in there. Hospitals can connect, physicians can connect. So it's really a safe but very open cloud. So they are also part of the whole program that we are now designing, or that we designed. So we will have for the first time the possibility to have long-term research for nutrition, for a nutritional intervention, what we desperately need, because these very, very expensive studies that the universities are putting out now, that are only possible with people like with organizations like the Baszuckis at the moment, they are the longest maybe for 3 months, maybe 6 months. But everybody always says, yeah, but can you do it long term? And yeah, I can tell. I'm doing it since 2014. I'm still alive. I'm striving. But we need the data, you know.
That's the fourth pillar, the much needed research and evidence, bringing that.
And also what we can do and what we can provide, of course, is if these studies have been done, we can do the bench to bed proof, because these studies most times, you know, they involve, like now, this very, very exciting study on polycystic kidney disease that was done in Cologne, at the university in Cologne. They had, I think, 36 participants, and it was fantastic, the outcomes they had on ketogenic metabolic therapies. But of course, they say the group was too small, the time wasn't long enough, we need more. We can't give it as an advice yet. So, but what we can do, we can, of course, with this group of fantastic medical team, of a fantastic, very high scientific, experienced medical team, they're all also in research. We can really also provide for these studies, we can provide the proof that from the bench from the lab to bed.
I've not heard that phrase. I like it, bench to bed. So back into the real world. It reminds me of the analogy you used earlier. What fuel would you put in your car? You know, how this, you know, we're talking science and evidence and academics and research, and it's amazing that actually beyond that infrastructure and that scaffolding is food changes. You know, that's what it all boils down to. So, and on that, how did your food changes influence your own family? I met Stefana earlier, and you've got children, grown-up children. What did they think when you started to change foods, and how did it influence them?
Now, this is one of the sadder parts, I have to say, in my whole new life as a keto activist, that that I was not very good in convincing my friends and my family, I have to admit. And still, I'm very sad because parts of my family are really refusing, and they say, no, we can't bear any fat, we can't live like this, and they don't want to come to have dinner with us because then they can't sleep because the food was so terrible.
Awful. What are you doing today?
No. No, but my husband, he was always very supportive, like he was already with my architectural career. But he still tried to get into ketosis in the beginning with having his daily pretzels. You know, Bavaria is very famous for pretzels, and they are delicious. I have to admit, this is one of the really terrible things. There is no substitute for Bavarian pretzels, I have to admit. But anyhow, he then got a stent. He had to get a stent. So he was already metabolically unhealthy. He is unfortunately also still on hypertension medication, but he's now really following a ketogenic metabolic therapy. And so he's my favorite cook.
Oh, lovely. It's so much easier when you're doing it alongside your partner and the people you live in a house with. You know, the people that I know that I coached or helped and supported, the ones that struggle the most who live with teenagers or a partner that doesn't support, so they're eating and bringing other foods into the house. But that comment that you made, it's so honest of you to say how your family are not complete converts, but sometimes I think that motivates us even more. And I've got family members, and I'm very sad too, that, I can talk about the successes I've had with groups and clients, but not with members of my own family. And it actually, it makes me quite sad. And it's not unique. I've talked to a lot of people in the keto low carb world, and they have similar experiences with their own children, for example, or mum or somebody. And that brings them sadness. And I think it helps motivate us because it's so personal.
It's true. Absolutely. And what you said earlier, it's so absolutely true. If I look at my family members who are already dead, unfortunately, they all died from metabolic diseases. It was stroke, it was a heart attack. None of them died of a natural death just by age. It was always a metabolic disease with terrible long-term chronic disease. It's not, I always say you can be lucky if the heart attack strikes you, because this is boom. But being demented or Alzheimer or Parkinson, I had friends suffering from this, dying from this, and it's just heartbreaking. It's heartbreaking. And if you know what you can do against it, or at least slow it, maybe not put it into remission, but slow it. It's
right to
really...
mention Alzheimer's and dementia. We've not mentioned those, but we know increasingly that they're part of this big picture. Some people call it diabetes type 3, but what the point is we believe that the changes to the brain cells and brain structure is caused by the insulin resistance and the damage it does within the brain. So yes, so that's where your prevention comes back in. Just on that point of that foods that those family members don't want to eat, I'm just wondering what it is. What's a typical in your Barbarino household, or if you're going out to eat, what might you eat?
Yeah, actually, we love to cook. We really love to cook, and we love to eat. So eating is really a treat for us, and so we most times eat in the evening because we have a very busy day. We do intermittent fasting, which is very easy if you're on a ketogenic therapy, because you're not hungry anymore, so you don't have the urge to eat like you had before with your sugar cravings, where you thought, I have to have some chocolate now, or a cookie or something like this. This disappears, and this is one of the big miracles, I think. For me, in my former life, it was always I was always thinking of food the whole time, with a bad conscience, of course, because I knew I shouldn't eat too much and I should eat modestly. And so this is gone, and this is fantastic. So food isn't the priority thought of my day anymore. It's very, very important. It's the therapy is my life now, but it's not that I feel guilty thinking about food or having food. I enjoy food. I enjoy our meals, and they are sumptuous because we can use, like my grandmother, who was, of course, in the time in the war, she always called it good butter. So it was the real butter, the real good butter. So this is still in our mind, but we have lard, we have really wonderful chicken skin. Of course, try to always get organic raised chicken or food anyhow. But also some people tell me it's much too expensive if you go on organic food. Of course, for some people it's also difficult to find because you have to research local farmers and things like this. But if you really go into it, you can find your local farmers. And interestingly, what we found, we don't need more money on our budget for food because we eat less. So if you eat less, you can afford the better quality food, and this is the wonderful thing. It's not only satisfying, you're not that hungry anymore, so you don't need so much food.
Yeah, those aisles of the supermarket that you're missing out on by not having to shop those inner aisles where the packet foods are. I do think, and I've looked at assessments of how this adds up, but if you're losing a lot of those packet foods, you can save money. And I did polls in some of those groups that I mentioned, the groups within the NHS, and there was about 20 patients in each group. And afterwards, I would ask them about their food changes and ask them to assess how much their food cost compared to the beginning compared to now. And the majority said it was either the same or less. So very much in line with what you said, but I do get that criticism of the keto low carb diet. Initially, it sounds more expensive because it's, potentially higher protein and vegetables and those things rather than the long life filler foods. But I think you can save money, and I've seen that's what patients have said as well. But yeah, I like that comment about feeling full. It's not that you're trying to restrict yourself, you're going without. You naturally can't eat as much. I remember putting food on a plate, and I used to pile my food up, and then I just could not eat the same quantity. The food's satisfying and it's nourishing and switches it switches that satiety, so you just don't need it, and then it fuels you for so much longer, which is the whole point of this. That you then can get on with your day and get on with your work and think straight. And it just switches off that noise.
That's so wonderful. Thinking straight is so wonderful. Absolutely.
Freedom to get on with your day and notice that the noise isn't there as much. But thank you. Thanks for sharing all about, your own personal journey and, a little insight into your family and how your food looks like. But, this incredible work that's coming and it's been going since 2019. And it was amazing in itself what you were putting out in the world, and now you're growing it. And I'm really excited. So in terms of, say, members of the public who are listening to this, or perhaps health professionals, how could they get involved, or how could they support?
And become members as well, because we give 50% reduction for all our educational programs for medical students, for instance. And you can become a professional member or just a founding member, and then you can get into these projects like with the Charlie Foundation.
Thank you so much for all of that information, and just being such a passionate and motivated person to put all of this out in the world and connect people and make a difference to so many people around the world. So thank you so much, Josephine.
Thank you, Claire, and thank you for all your great work. It's fantastic. Thank you so much.
Thank you for watching. If you like this video, please make sure to subscribe. This really helps us to be able to create more content.